Welcome to Evidence Mastery with Dr. Masood Tosi. I am going to help you understand what chronic heart failure is and how it is managed. Please note that this explainer is for education only and will not replace your doctor's advice. Today, we're going to dive deep into a really important topic, chronic heart failure. Now, I know that's a condition that affects millions of people, and my goal here is to help break it down into clear, understandable pieces, all grounded in the latest scientific evidence.
So, here's our roadmap. First, we'll get on the same page by defining what heart failure actually is. Then, we'll talk about what it looks and feels like, the symptoms and signs. From there, we'll get into the core of modern treatment, what we call the 4 pillars. We'll also look at therapies that go beyond just medication. And finally, we'll wrap up with the prognosis and the most important takeaways.
Okay, let's jump right in. Because before we can even begin to talk about how to manage heart failure, we really have to have a crystal clear definition of what we're dealing with. You know, at its very core, heart failure is a mismatch. Think of it this way. The heart is a pump, and the body has needs. Heart failure is what happens when that pump just can't keep up with the body's demands for blood and oxygen. This can be because the pump isn't pushing enough blood out, or because the pressure inside the pump gets way too high when it's trying to fill up, or, as is often the case, it's a bit of both. And make no mistake, this is not some rare condition. The data shows us that in the United States alone, we're talking about nearly 7 million people living with heart failure. That number really drives home just how vital it is for all of us to have a solid understanding of this. It's also so important to understand that heart failure isn't something that just happens overnight. It's a progression, a continuum that we stage from A through D. Stage A is someone who's just at risk. Maybe they have high blood pressure, but their heart is still working fine. In stage B, some structural changes have started, maybe from a past heart attack, but the person still feels perfectly normal. Stage C is when the symptoms finally start to show up. And stage D, well, that's the most advanced stage, where patients often need very specialized therapies to manage their condition.
Okay, so we've defined the what. Now let's get into the how. How does heart failure actually present itself? What does it feel like for a patient? And what are the telltale signs that a doctor is looking for?
A lot of the common symptoms really come down to 2 main problems: fluid backing up and the body not getting enough blood flow. This leads to things like exertional dyspnea, that's getting short of breath with just a little bit of activity. People find they just can't exercise like they used to. You also see peripheral edema, that classic swelling in the ankles and feet. And for some, it can even affect their appetite or cause a nagging cough, especially at night.
Now, within that shortness of breath, there are 2 very specific types that are important to distinguish. The first is orthopnea. That's when you lie flat and almost immediately feel like you can't breathe, so you have to prop yourself up on pillows to sleep. The other one, paroxysmal nocturnal dyspnea, or PND, is much more dramatic. This is when someone wakes up from a deep sleep hours later, gasping for air. The key difference is really the timing and how long it takes to feel better after sitting up.
So when a doctor is examining a patient, there are a few classic signs they're looking for. All that high pressure in the heart can cause fluid to back up in the veins of the neck. We call that jugular venous distension. When we listen to the lungs, we might hear crackles, which is literally the sound of fluid in the air sacs. And of course, as we've mentioned, there's the visible swelling, the edema in the legs and feet.
All right, let's talk about treatment. And this is where the story gets really hopeful, because the way we manage heart failure has truly been revolutionized in recent decades. Modern therapy is built on this incredible foundation of evidence, especially for the type of heart failure with a reduced ejection fraction.
So this is absolutely crucial. For patients with a specific type of heart failure, we call it HFrEF, or heart failure with a reduced ejection fraction. The treatment strategy is built on 4 foundational classes of medications. We call them the 4 pillars, and the evidence is just overwhelming. These therapies improve survival. And here they are, the big 4. We have ARBs, beta blockers, MRAs, and SGLT2 inhibitors. Now, they all work in slightly different ways. Some relax blood vessels, others calm the nervous system, some block harmful hormones. But despite these different mechanisms, they all lead to the same single most important outcome. They reduce mortality. They help people live longer. Let's start with the first pillar, the ARNI. The main one is a combination pill called sacubitril/valsartan. Its major effect is as a potent vasodilator. It essentially helps relax and widen the blood vessels, which takes a huge load off the struggling heart. And based on landmark clinical trials, it's now considered the standard of care over some of the older medications.
Pillar number 2, beta blockers. Think of the heart in heart failure as an engine that's constantly revving way too high. Beta blockers help calm down that fight or flight response. They dial back that overdrive, slow the heart rate down to a more efficient pace, and ultimately protect it from long-term damage.
Our third pillar is the MRA class. These drugs, with spironolactone being a common example, are fantastic because they block a nasty hormone called aldosterone, which promotes fluid retention and scarring in the heart. They do help get rid of some fluid, but their real magic is in that hormonal blockade. We just have to be careful to monitor potassium levels with these.
And that brings us to the newest, and frankly, one of the most exciting additions to our toolkit, the SGLT2 inhibitors. These were first developed as diabetes drugs, but it turns out they have incredible benefits for heart failure patients, even those without diabetes. They work on the kidneys, helping the body get rid of extra sugar, salt, and water. The results? Less strain on the heart, and, as major trials have shown, a significant improvement in survival.
Now, those 4 pillars are the absolute cornerstone of medical treatment, but they're only part of the puzzle. Truly comprehensive heart failure care goes way beyond just writing prescriptions. It demands a much more holistic approach.
And this is where the patient becomes such a critical member of the team. Education is everything. Understanding the condition, knowing what to watch for, it's vital. This includes major lifestyle commitments, like seriously restricting salt intake and checking your weight every single day to catch fluid buildup early. Then, for certain patients, we start to think about other things, like device therapy or even surgery in the most advanced cases.
Let's quickly break down 2 of the most common devices. On the left is an ICD, or implantable cardioverter defibrillator. Think of this as a firefighter, an emergency safety net. It constantly monitors the heart's rhythm, and if a life-threatening arrhythmia starts, it delivers a shock to restore order. On the right is CRT, or cardiac resynchronization therapy. This is more like a conductor for an orchestra. It uses tiny wires to help both sides of the heart squeeze at the same time, in sync, which makes the pump much more efficient.
So, we've covered a lot of ground. Let's bring it all home now. What's the outlook for patients living with chronic heart failure today, and what are the absolute key points you should walk away with? Now, we have to be honest. The evidence tells us that chronic heart failure is a very serious condition. Looking at the data, the 1-year mortality rate can be anywhere from about 7 to 14%. But, and this is so incredibly important, that's not the whole story. The data also clearly shows that our modern therapies, especially those 4 pillars we talked about, are actively pushing that timeline back, improving outcomes, and giving patients more quality time. So if you only remember a few things from our time today, let it be these. First, heart failure is common and it's a progressive disease. Second, for the HFERF type, treatment is built on 4 life-saving pillars of medication. Third, pills are not enough. Lifestyle changes and patient involvement are absolutely essential. And finally, for the right patients, we have amazing advanced therapies like devices and surgery that can make a huge difference.
I really hope you found this breakdown helpful. Please feel free to share your experiences or any questions you might have in the comments below. Just note that I can't answer personal medical questions. If you found this information valuable, don't forget to subscribe to the channel for more evidence-based explainers.